And that was hard.
Yes! Ang
Yeah.
hirap-hirap. Gusto ko dito.
Yeah. Maybe next Friday.
Yeah, with them.
Try it with us,
You did it the last time.
Yeah, I know. Okay, this time, welcome to our segment, Saludo Sa'yo, kung saan ipinagpupugay natin ang mga individual na buong pusong naglilikod sa kapwa na walang hinihintay na kapalit.
And this morning, we are privileged to have Mr. Christopher Foo, a Singaporean businessman who's been helping the Filipinos for 12 years through free training in livelihood projects. He is joined by his partner in this advocacy, our good friend, Dr. Paulo Villasilio, a diplomat doctor of natural and integrative medicine.
Wow, welcome back, Doc Paulo.
Good
Hello,
morning.
Mr.
Good morning, everyone.
Good morning.
Good morning.
English. Oh, good morning. Yes.
Magandang umaga.
Magandang umaga, la.
Yeah.
And you've been living here for...
Well, frankly speaking, I started into Philippines 12 years ago.
12 years
12
ago.
years
12 years ago.
What
And-
brought you here? Love?
No, strictly for business.
Strictly for
Yeah,
business.
strictly for business. And when I stepped into Philippines 12 years ago, I really did not know what to expect. I get negative comment from certain people about Philippines.
Yeah,
But
we
I
get
realized,
that a lot.
yeah, a lot. But I told myself, if I want to build a business, I want to have a country with large population.
Oh, that's the Philippines.
Yes, because where I come from is a smaller country.
Yeah.
With currently it's about 5 point something million. And I realized that if I want to build a business, I need populations. Yeah, and I purposely picked Philippines because of English speaking.
Yes.
But many of the Filipinos here are also in Singapore. But
Yes.
we're still a lot here.
Yes, there are about probably, I don't have the exact figure, but I think probably we have about 400,000 Filipinos working in Singapore.
Okay.
Yeah, in various industries.
So you came here for business, and how did you meet Dr. Paulo?
That was a few years ago when I was introduced to him by his mom.
Yeah.
And well, I brought this business, this health supplement business into Philippines. Again, I say I didn't know what to expect. But as I travel around for the first few years, I realized that Filipinos suffer from a lot of dreaded diseases.
Okay.
I went to many islands, many provinces. One of the islands I went to was Romblon.
Romblon.
Yes.
Yeah, I was told that usually not many people go there. It's a small little island. I can't even find Jollibee in the island. You know?
All this fast food chain, yeah.
I in fact staying there for about 10 days. I lost probably about 3 pounds.
Oh, we should go there.
We need to go there.
It's good for you, for
thank
people
you
who are
very
slim
much.
down. Yeah.
No, I'm sure the audience would like to hear what's the advocacy all about.
Basically, I wanted to focus on business building. That's the number one thing. But as the time passed by, because I come here once a month, as time passed by, I realized that health is critical to the people in the Philippines. I was told by many people that Filipinos, their lifestyle is not so good. The food they consume not very healthy. Fatty food.
Lifestyle in what way?
Lack of exercise.
The food we eat, the
Yeah,
vices,
the food
I
you eat,
guess.
yeah.
High in saturated
And of course, the people who are smoking. And I realized that Filipinos don't really sleep early
Yeah.
because of Facebook. Yeah, because of Facebook.
No.
Yeah, I was told. Yeah, but my experience here proved one thing, that as I travel around to many parts of Philippines, I realized that I could do one thing for Filipinos, that is to bring health benefits to them.
Okay.
Yeah, you know.
So how exactly did you do that, especially for the Filipino people?
First of all, I tried my best to educate them in some ways and introduce to them the health supplement. And one thing is good is that among my business partner, we bring medical mission. I brought medical mission to Lawak,
Lawag.
yeah, Bataan, Batangas, Laguna, Mindoro,
Wow.
yeah.
You traveled the Philippines
yeah, I
more than
traveled
I
the
did,
How
and
many
I'm a
doctors
Filipino.
do you bring?
Usually one, and
That's him?
not him yet. But I went with Ryan and a few other one doctors and a couple of nurses. We do heart tests for them, yeah. And through the heart test, we were helped to analyze their situation in the physical.
What's that test?
That's what we did
Doc
the last
Paulo?
time, the arterial pulse wave and stress test.
With this, the
which
use of
we
this
do with a
computer?
group.
Yes.
So we go to government corporations and even areas stricken by typhoons like Yolanda in Tacloban. I've been there, bring this technology there to determine the vitality or immune system of the person, as well if the arteries are clogged and if the heart is working perfectly well or not. So he's talking about the same technology which we as a group do separately from each other all over the Philippines.
So does it have to do with like going there right after a typhoon, or this is done like you can check it anytime?
Well, basically, our nation-wide heart campaign or the Health on Top is basically anytime. But as you very well know, because of the typhoon, like Mario, like Yolanda,
Yes.
Glenda, those things, we readily respond. Not necessarily out of NCR, but we service people in NCR, the municipalities or cities first, and then eventually outside. I go around also. So what he's saying is we share the same research and studies that we impart to people through education, talks or seminars, and these are for free. And the stress test or artery test, which basically, costs in the US $200. In our centers, it costs 600 per test. We give it for free too.
Okay, can anybody just go to your centers?
Well, what we can do is you can get our numbers and then we can probably prepare or organize a team to go to your place.
And
Okay.
how many should they be?
Well, usually if we could service around 30 to 50, that would be manageable.
Okay.
Yes.
Sorry, how long will it take?
Okay, the stress or the artery test together is just 2 minutes and 30 seconds, 3 minutes.
okay.
And then with your consultation, very quick, probably a total of 8 minutes per person, 8 to 10 minutes.
Yeah.
So we could reduce more mortalities and morbidities brought about by cardiovascular disease or cancer.
Okay. Okay. I will have to ask Mr. Fu,
Yes.
why, of course, this is a famous question. Why the Philippines? And why the Filipinos?
Oh, yeah.
Well, okay. I met.
Because
Yeah, I
we're a
met.
lot.
We're pretty, we're
no.
cute.
I met someone.
Aside from that,
12 years ago, I met a gentleman back in Singapore, and I thought he lost his passport in Singapore, and I
He's
spent.
Filipino.
He's a Filipino, and I spent 4 hours with helping him to get his passport back, and he was very appreciative, and he flew to Malaysia, and I told him that is there any way I can do something in Philippines? He said, yeah, you can. So I think, why don't I come by and explore with health supplement? And he said, okay, let's go. But I realized that the population size is just huge. And you have got, 7,100 islands?
So you see a lot of potential
A lot of
here.
potential. And in my mind, I also thought that I could probably do any other businesses. In fact, currently I'm negotiating with my business partner to do several businesses. I'm investing into the business, bring some investor into to Philippines. Why particularly Philippines? Because I realized that after so many years, Filipinos are so warm.
And resilient.
They are very. They treated me so well. I really appreciate it. They give me a feeling that they are kind, peace loving, and I realized that in Philippines people are so talented. They sing well, they dance well,
Yeah.
and they love to socialize.
Yes.
yes,
They love to talk,
yes.
and I think they are looking for business opportunity.
Yes.
You see, when I see Filipino going out of the country, I realize that there's something I can do so that they can stay in Philippines and do a business, earn their livelihood, and provide for their family.
Yeah.
Yeah, that's
Everything you're saying is true.
it's very
Yes.
true. I know thousands of people in Philippines, and they will vouch for what I say.
Yeah.
Yeah.
Okay, thank you so much, Mr. Christopher Foo. And of course, Dr. Paulo Bellucilio. Saludo kami sa iyo.
Thank you
you.
very
Thank you.
much. Thank
Salamat.
you. And for our arts and crafts segment, here's another creative and eco-friendly project. Let's all watch this.